Welcome to Hillrom's tutorial on proning patients using safe patient handling and mobility equipment. Proning patients with acute respiratory distress syndrome may increase oxygenation and reduce mortality, but the practice is difficult to perform manually. Safe patient handling and mobility equipment can make proning feasible by taking away the heavy lifting and allowing you to protect your patients. In this tutorial, you will see a new method proposed by Hillrom that uses a lift and 2 multi-strap accessories. 3 caregivers are recommended, but others may be needed depending on circumstances. This solution allows the patient to be supported securely by the lift motor, which helps you manage accidental extubation or other challenges from the proning process. Before we get started, it is important to note that every patient handling situation is different. Consider these variables when it comes to your patient: size, morphology, weight, and condition. Hillrom's lifts and soft accessory products are designed to lift and transfer patients with trained caregivers using their best clinical judgment to implement the use of these products. Before proning a patient, make sure the patient meets the inclusion criteria per your facility's policy for the procedure. This method works by placing the multi-straps off-center under the patient. Measured from the center of the patient, the multi-strap should be longer on one side than on the other. The patient will turn in the direction of the long side of the strap and towards the ventilator. Plan which direction the patient will turn and adjust equipment, attached tubing, leads, and lines so there is enough slack during the movement. Raise the bed to a proper working height and lower the side rails. Slide the multi-strap under the patient using the pocket. Placing the straps under larger patients may require turning the patient either manually or using the LECO handy tube or handy sheet positioning aids, which may help slide the multi-straps under the patient. When placed, the top of the upper strap should be near the armpit, and the top of the lower strap should be near the greater trochanter. In addition to placing the strap off-center, this difference can be achieved by connecting a shorter or longer loop to the sling bar. If necessary, an extension loop can be used to extend the length of a strap. Lower the sling bar to connect the loops of the multi-straps, taking care to ensure the strap is seated properly on the sling bar. The sling bar is rotated so that it is parallel to the length of the patient. One caregiver raises the sling bar until there is tension in the straps. Then, the team confirms all required loops are secure in the sling bar. Position the patient's limbs to prepare for turning. In this case, the patient is being turned to the right, so the left leg and arm are crossed over the patient. The right arm is tucked to the side. This is important because it will later help the patient rotate to the prone position. The patient is ready to be lifted. The caregiver on the left side will operate the lift, while one caregiver on the right monitors the lines and the patient's response. The other caregiver at the head of the bed will manage the patient's head and airway. The patient rotates to the side. The lift movement is slow and controlled and can be paused if needed. Lift the patient high enough so they are easy to slide, but do not lift the patient fully off the surface. Slide the patient to the side of the bed. The caregivers on the right side of the bed should manage tubing and lines and prepare pillows, wedges, fluidizers, foam blocks, or anything else that will be placed underneath the prone patient. When all caregivers indicate they're ready, lower the patient to the prone position. Pause as needed to replace electrodes to the back. Check lines and tubes. Reposition the patient, tubing, and lines as needed. The patient's limbs should be adjusted, and the body should be supported consistent with best practice. Lower the sling bar to detach the loops of the multi-straps. Gently remove the multi-straps from underneath the patient. To protect the patient's skin, fold the straps under when removing. For a patient with skin concerns, consider using handy sheet aids to help with removal. The process is complete. Stow the lift, raise the side rails, and return the bed to the proper height. The process can be performed in the same manner to return the patient from the prone position to supine. If you have any questions, please visit hillrom.com and select Contact Us for local contact numbers and office locations. Thank you for all that you do to help protect patients by mobilizing earlier and often.